I tell people it's not the amount of stitches that I use. It's how do I stop your bleeding and how do I get your vagina to look the way it looked when you walked in here. I want to make sure that you're not going home with like an extra appendage.
Please put Miss Mama's back the way you found her. Okay, please put her back the way you found her.
I try. I do. I really try. Because ain't nothing more. Okay, you know, we're all people. We're all adults here. And, you know, you be sensitive about, like, what your girl look like.
Yes.
Right?
Yes.
And, like, you don't want to go home and be like, that was not there when I left. So that is my, like, biggest thing. I want to make sure that it looks the way it looked when I found it.
Yeah. Yes.
Okay.
There, amazing listeners. Before we dive into today's episode, we wanted to share something exciting with you. That's right. It's all about the Laborhood merch shop. And we've got some fantastic custom merchandise that we think that you will love. When you shop with us, you not only get some fly gear to show your Laborhood pride, but also help us keep this podcast going strong. We've carefully selected some items that we think that you will adore, from comfy t-shirts to stylish accessories. There's literally something for everyone. And the best part, you can find all these fantastic goodies on our website. Just look for shop in the menu. It's more than just merchandise. It's a way for you to support our mission in supporting maternal health care. So whether you're sipping from your Laborhood water bottle or sporting one of our tees, you're making a statement and helping us create a safer and better birthing experience for all. Check it out today, and thank you so much for being part of the Laborhood gang. Now, let's get back to today's episode.
Hey, Laborhood gang.
Hey, guys.
Gang. We are back with another episode.
Next episode.
Did you miss us?
Because we missed you.
We missed y'all.
So welcome to the Laborhood. If you are new here,
First off, welcome.
I am Briea. I'm one of your co-hosts for the Laborhood Podcast.
I'm Shay. I'm one of your co-hosts for the Laborhood Podcast.
And if you're new here, of course, we like to let you guys know what the Laborhood is about. We are two Black birth workers. I am a inpatient obstetrics registered nurse.
I'm also a registered nurse in inpatient obstetrics. I think I said it right this time because last time I effed it up. I'm also a board certified nurse midwife.
Boom. And so on the Laborhood, we like to talk about all things labor, from clothes to complete and all the little things in between. And we want to educate all of our mamas out there and daddies and any birthing person. We want to educate them on the things they may not know and the things they may want to know more about, so that they can have the most educated and the most empowering birth experience that they can possibly have.
Yes. We want to make
the scary things not so scary.
Yeah.
Yeah. So we talk about them here on the podcast. Today's episode, I think it's one of the things that
most people are afraid of.
They're afraid of, and some don't like to talk about it because I think it's kind of goes back to that weird badge of honor thing. Like,
yes.
Oh, I didn't.
Nobody should have a badge of honor. And if that's the case, we're going to make it where everybody has a badge of honor. Because if you can grow a baby from scratch, which is something that
I ain't even done yet.
I ain't did it.
I'm actually not trying to do it.
You are my hero automatically.
Yeah, and I'm not trying to grow one right now, so it's fine. But yeah.
Neither am I, actually.
So this episode, it's entitled TRL. But it's not the TRL that we know and love from back in the day. Our TRL stands for Tears, Repairs, and Lacerations. And that
sounded scary.
That sounds absolutely horrifying. But we're gonna make it not so scary because we're gonna tell you some things that you might not believe when it comes to lacerations and tears and how we repair them and how you take care of them and all those good things. So we're just going to jump right into it. We're going to jump right into it.
This is my tidbit. Always remember, whether you are a birthing person, you are a nurse, you are a provider of any sort, you are a doula, a lactation consultant, or even if you're just listening to the podcast because you like to hear us talk, the vagina is very forgiving.
She is.
The vagina
literally.
is very forgiving.
Literally.
Very forgiving.
In a lot of aspects. Like, not just this part.
I mean, yeah, she is very forgiving because, baby, she just keep right on going.
Listen, them cells, they just go right on back. They grow right on back. It's fine. No, I really think that is like, I think your vaginal cells and the cells in your mouth are like some of the fastest growing cells on your body.
Did you know that the vagina is actually cleaner than the human mouth?
Yes, I did know that. Which is crazy.
It is.
I mean, the average. Like, because listen, I've seen a lot of them, and when the results come back, sometimes it's not so clean. But then, you know what? We make medicine for it, and we'll get you your testicule gonna come back negative. That's okay. That is okay. That's okay. Some people slip up, and that's okay. We got something for that.
I am just ultra weak.
Be safe, okay?
Moving on.
Moving on. The vagina is very forgiving. She's very forgiving.
She self-cleans herself. She uncontrollably bleeds every month for the rest of your life, for like 20 years, and then, well, actually like 40 years.
Yeah.
And then she stops bleeding on her own. She stretches and then goes back. She's forgiving. The vagina is very forgiving.
She forgives. Okay. So of course, tears and lacerations happen when a vaginal delivery has occurred.
Yes.
And it's gonna surprise you. Tears are common. I think people come in like, I just don't want to tear. Well, Stink, I'm gonna go ahead and let you know, it's baby number 1. You might have a little something. A little something.
Yes. According to, I think it was ACOG, anywhere from 53 to 77% of births, vaginal deliveries, have a tear. That's and even at the 53, that's well over half.
Well over half.
That means at least one of us is gonna have a tear in this room.
Yeah. Literally.
If not both.
It's probably both.
If not both.
It's probably both. But that's, I think people just go into it like being like, okay, I might have a little tear.
Yeah. But remember, the vagina is very forgiving.
She is very forgiving. And sometimes if this is not baby number 1, you have to remember, if you have a scar from that first baby before, that tissue is not quite as strong as she used to be. Mm-hmm. So that tear might occur again. But that's, again, we expect that. Mm-hmm. That's to be expected.
Hey there, Laborhood gang. This is Shay, one of your co-hosts of the Laborhood Podcast, and I've got something very special to share with you. An exclusive offer that is just too good to pass up. Have you ever heard of Hello Bello? If not, you are in for a treat. Let me tell you. Hello Bello is all about making parenting easier and more affordable, and we are thrilled to partner with them as Hello Bello enthusiasts. With Hello Bello, you can get high-quality baby products that won't break the bank. And here is the best part. We've got a unique code that will score you an incredible 20% off of your very first order. To snag this deal, all you have to do is use our special link and apply the code THEL at checkout. That's not all. Hello Bello was co-founded by none other than Kristen Bell and Dax Shepard, parents who believe that all babies deserve the best, and we do too. They are on a mission to make premium parenting accessible to everyone, and their products reflect that commitment. Hello Bello crafts their products with babies, parents, and the planet in mind, all while keeping prices as low as possible. So let's make some magic together on our journey to bring premium parenthood to you all. When you use our unique code, THEL, not only do you get an amazing discount, but you also support the Laborhood Podcast. Thank you so much for being a part of our amazing Laborhood gang community, and happy parenting with Hello Bello. Now let's get back to the show.
So let's tap into the types of tears or lacerations. You might hear them used interchangeably depending on what your provider says or, you know, what your nurse says. We might say either or. So there are types of tears, and like they kind of, it's like a tier.
Yeah.
It's like a tier.
Yeah. They occur in relatively 4 stages.
Yeah, it's 4 different tiers.
Excuse me, 4 different tiers. And 3 has like some side sister steps.
Yeah.
But
like a 3A,
a
3B, a 3C. So top, so we have our first degree.
Skid marks, scrapes, scratches.
It's literally like if you like scraped your knee on the
sidewalk, like on the concrete,
like, and you know what that scrape looks like. That's what happens to your vagina. Like
anytime you ever hear, you're like, oh, you have an abrasion, or you have like a little first degree. It's very minimal. It's small. It's tiny. Yeah.
It only involves like the first layer of skin around the vagina or the perineum.
Skin, yeah. I feel like they are most common because typically that's what I will either see that or the next one. Yeah. Especially like if people who have multiple babies down the line, like they've had 4 and 5 babies, like by the time you get a 5th baby,
yeah, you won't have anything.
You have like a little skid mark.
Unless it just, you know, flew out of there. Yeah. Then, you know, we talk about that. But yeah. So that first degree is like your little abrasion, your skid mark. Usually you don't need stitches because it is just like it's a scrape. So the tissue is not quite torn to where it needs to be put back together, if that makes sense.
And typically we only put stitches if it's bleeding or if it needs to be put back together. Like, that's not gonna look right when you go home.
Right.
And I
need to put that back. It's gonna be like weird. Yeah. You know, you're gonna be able to notice that it's different.
Right.
And so with those first degrees, you don't have to do that because it's literally just like a little scrape. A little scrape. It's gonna burn.
It's a little boo boo.
Yeah, it's gonna burn when you pee. But again, because the vagina is so forgiving,
very forgiving,
and those cells grow so quickly, it's like. You'll be okay. You'll be okay. Put a little ice, use your peri bottle, and I think you're gonna be good.
Yeah.
So that's your first degree. So that's your first tier. Least severe.
It heals the quickest.
Heals very fast. Now, our next girly is our second degree. I'm just trying to think how this best way to say it. Anyway.
She's your white tee. Like, everybody got one.
Everybody got one. Okay.
She's your white tee.
She can be your white tee. Everybody's probably got one. If you've had a baby before, you done had Miss Girl.
Yeah.
So your second degree laceration, it extends a little deeper through the skin into those underlying muscles of the vagina and perineum. So let's also talk about what's what. Your perineum is the skin that's between your vagina and your booty hole. That's your perineum.
We are not going to make booty hole thing on this podcast.
Okay, your rectum.
Thank you. I can actually hear him laughing.
Yeah. Girl, okay, your butt. Whatever. If you put a mirror down there and you trace from your vaginal opening to your booty.
Mm-hmm. It's usually about like 2 maybe to 4 inches.
Yes. Depending on your body. Everybody's anatomy a little different. Some people's might be a little longer, but that's fine. But your second degree kind of goes into those underlying muscles of the vagina and the perineum. And these, you are going to need some stitches.
Yes, absolutely.
Because again, that tissue has now that's not just scraped anymore. It's like separated.
Correct.
And this question, I was literally thinking about this last night. When people are like, well, how many stitches do I need? But here's the thing. You have to understand that it's kind of like...
It's not like...
It's like crocheting.
Yes. I was going to say, it's
not like where it's just one piece cut, where you can individually count the stitches. It's like a running stitch.
Yes.
It looks like it's actually... weird to say, but it looks like floss, like one long string with a needle on the end, and they just keep going with a running stitch to put that. perineum back together.
It's hard because Google censors a lot of things. So you can't, like, you can look up perineal repairs, but, you know, like I said, Google censors a lot of stuff.
Right.
So I think when people think about, like, stitches, how many stitches do I need? And, you know, like, if you fall and gash your head open, like, you can visibly see those stitches.
Yes.
But you can't do that on a vagina.
Right.
It don't work like that. So I can't count how many. I tell people it's not the amount of stitches that I use. It's how do I stop your bleeding and how do I get your vagina to look the way it looked when you walked in here. I want to make sure that you're not going home with like an extra appendage.
Please put Miss Mama's back the way you found her. Okay, please put her back the way you found her.
I try. I do. I really try. Because ain't nothing more. Okay, you know, we're all people, we're all adults here, and you know, you be sensitive about like what your girl look like.
Yes.
Right?
Yes.
And like you don't want to go home and be like, that was not there when I left. So that is my like biggest thing. I want to make sure that it looks the way it looked when I found it.
Yeah. Yes.
Okay. Continue. We can continue.
Listen, no, I get it. Also, just, you know, this is just a little side note for the support people in the room, particularly the ones who helped make said baby that made this laceration.
If you want to get embarrassed,
don't you dare mention anything about how it's supposed to be put back together, how tight or loose you want it to be. Don't you dare. Don't.
Because let me tell you, I will embarrass you.
And me, the nurse, I'm going to laugh, so I'm going to make it worse. I'm gonna
embarrass you. It'd be like, oh, can you throw an extra stitch in there? Sure. Would you like Vienna sausage or more like a pencil?
How small do you need it?
Yeah.
And then we're all, now it's awkward. Now you made it, it's not joyous anymore in here. Now it's awkward. You see how you ruined it? We just talked about the golden hour and you ruined it. You ruined it. Be quiet. You are here for support.
I'm like, yeah, sure. I can put another stitch in it, but she will probably never sleep with you again.
So yeah.
Oh my gosh. Please don't be that person.
I'm gonna step off that soapbox, but yeah, don't.
Oh, my blood is boiling.
Don't mention that.
Oh.
Don't mention it.
Do not.
Thanks. You're just here for support. That's all. That's all.
Okay.
Okay. Are you okay?
No, I'm not. I am not okay. And I need a second because I am literally like wringing my hands together.
I had to throw that in there though.
Kisses me. Oh,
I had to throw it in there though. It does. It is. Because I've grown this little human and I've put my body through a lot.
And for you
to talk about what you want.
Oh gosh. Okay.
It's fine.
I'm gonna breathe.
Okay, we're just gonna take a breath.
Hey, Laborhood gang. We are so grateful for all of you to tune in and make this podcast so special. That's right. We truly appreciate your support, and we wanted to let you know about a way you can take that support to the next level. Absolutely. You can now become a supporter of the Laborhood Podcast by pledging a monthly reoccurring amount. You can help us continue our mission to advocate for and support birthing persons and their families. It's super easy to do. Just visit our website at www.thelaborhoodpod.com or check the description of this episode for the link. Your contributions help cover the cost of producing this podcast, reaching more people, and making a positive impact in maternal health care. So, if you're a person in a position to become a supporter, we would greatly appreciate it. Every little bit goes a long way. And remember, you're not just supporting the podcast and us, you're helping us create a safer and better birth experience for many people. Thank you for considering it, and thank you for being a part of the Laborhood family. Now let's dive into today's episode.
So with that being said, we're gonna move on. Second degree, you know,
right.
Again,
second degree tears.
Yeah. So,
all right. These require some kind of anesthetic on board. Whether you have an epidural, whether you are unmedicated, we're going to give you something to numb this area because you may need more than one little running stitch.
So we'll give you a little what we call local anesthetic. So like lidocaine or something like that. Same kind of thing the dentist would use to like numb you up teeth, to do a procedure in your mouth. Same exact medication. It sounds kind of bad because we do take a needle and we inject it, but you're going to want to feel that rather than the stitching, if that makes sense.
It's usually like a pinch and a burn. It lasts like 2 or 3 seconds and then you're done.
Yeah.
And you're nice and numb and then you don't feel anything.
Yeah. So yeah, there's our second degree. Most common, and again, tears are common. It's okay.
Tears are common because you know why? The vagina is very forgiving.
We're going to keep saying that. Okay, so next is our third degree. So the third degree extends from the vagina to the anus. Now,
you can say booty hole.
No, you told me not to say booty hole, so now I ain't saying it. But she also has like steps. Yeah. So we have 3A, 3B, and 3C, and the A, B, and C, I think, determine how much of the
actual rectal sphincter is involved. Right. So if a 3A is like down through the skin, down through the perineum to the top, it's like the mucosa of the anal sphincter. Yeah. The 3B is more into that muscle just a little bit. C down into the actual anal sphincter itself. Yeah. And then 4 is like, well we ain't got her yet.
But yeah, so 3A, B, and C. And so when we start talking about, our third and, on, only about, according to the Cleveland Clinic, only about 5% of women have a third or further tear. Yeah. So not a lot. Mm-mm. Not a lot. And I can say that even as a nurse, like we don't really have a lot of like your third and fourth degrees. No. Again, that the first and second.
I think I've seen like 2.
Like that you've done?
No, because if we start going into anal muscles,
yeah, I gotta call somebody
because I didn't. Yeah, that's not my ministry.
Yeah.
I need to call an actual person.
It's a little further than what I can with my
scope allows.
But yeah, so I'm like, even as a nurse, I don't really see a lot of third and fourth degrees.
I've seen like a good 3. I have seen a 4th though.
I have
seen a 4th, but she had like, okay, wild story. We're pushing. Okay. I'm in midwifery school. I'm a student.
Flashback.
Okay. I'm a student. And we're pushing. We've been pushing probably like 2 hours at this point, and she is making great progress. I look down, and there is an eye coming out of her booty hole. Like, so the baby is crowning
like a physical like eyeball.
Not like the eyeball itself, but I can see the baby's eye. Her perineum is intact from the outside. She just had really, really poor tissue. Like, she just had really, really poor tissue. But, like, her perineum was completely... It was her first baby. Her perineum on the outside was completely intact, but I could see baby, perineum, and then, like, where her rectum was, I could see, like, hair and an eye as the baby was, like, coming out. Oh gosh. One... freaked me out so bad.
I would have been like, just stop whatever you're doing. I would have hit every button. Somebody please come.
So
because what's happening?
I'm the midwife student, and I'm looking at my supervising midwife like,
do you see what I see?
Hello?
What's gonna happen?
Hello? What's gonna happen? I'm like pointing like. She was like, that's fine. We can go ahead and give the doctor a call.
Yeah, because we're gonna need him.
The next push, she had like a beautiful baby. It was fine. Babies' Apgars are 8 and 9. Yeah. She's doing skin to skin. It's golden hour. It's beautiful. She has a vaginus. A vajasshole. I have never in my life seen something like that. Like, to the point where, like, is how do we put this back together? Because your perineum is still intact.
Now, that would have blew my mind. Because what? Because you would think the perineum, you would think that tissue is much more susceptible to tearing.
And it's thinner.
As opposed to...
And it's thinner.
Yeah, your rectal wall? Was the baby like coming out with like a...
No, not a compound presentation.
I was gonna say, no, that's when I expected like the arm is like this and the elbow was just, you know...
Nope.
Just head, just baby head.
Head. Because I was like, what is black? Like, what is that?
It's not poop. What is that?
What is that?
Oh my God, what is that? Oh my God, what is that?
And it was hair. And then, like, as she pushed some more, like, that was an eye. And I was like, yo. Hey, look, you know how you be with your friends and you see something wild and you be
Hey,
like,
bro,
hey,
look.
it was like that.
Oh my God. I don't mean to scare y'all, but that's a good...
Okay.
But that's rare.
That's rare. That is a unicorn.
That is a unicorn, because I'm sure even OBs that have been practicing for umpteen years have never seen something like that.
I mean, I can't tell you who the doctor was. I'll tell you after this, and you'll be like, duh, of course.
Of course it would happen to them. Oh, God. Oh, man. Of course.
He was like, well, how'd you do that?
I don't know.
I don't know.
Okay.
Okay.
That was a good little...
Sorry. Segue.
Anyway, yeah, so...
Third and fourth degrees.
Now we're into our fourth degree. So again, it is the least... Fourth degree is our...
least common.
That's as far as we can get. It's the least common, but it is the most severe, because now it extends all the way through. It's like a bullet. Yeah. Through and through. Through your anal sphincter.
Yeah. Where you defecate.
And where you can hold it or you can't.
Yeah.
We are through that muscle.
Yep. Mm-hmm.
And these usually are not repaired in the... Like, usually doctors like to go to the OR.
Or have OR utensils at the bedside so they can get a clear visualization of what they're seeing, so they're not putting stuff back together wrong.
Yeah. Because, again, the same way it went down, you gotta put it back together in the right layers, in the right order. Yeah. Sometimes you just need the extra light in the OR, because again, OR is, delivery rooms can be bright, but the OR lights, we got a few different lights we can, bring down and shine down, and so doctors can get a better visual. And like you said, sometimes you need certain like retractors to pull, the labia back, or, sometimes doctors like to go to the OR because you can give a little bit of more heavier medicine.
That's what I was about to say
get
too.
mamas really numb.
If we need to do like a fourth degree repair, like you're getting something a little bit heavier on board. Yeah. Even if you have an epidural, you're probably still going to get something else.
Yeah. Even if they want to do it in the room, they'll usually call anesthesia and say, hey,
can you dose her?
Yeah, we got a fourth degree. We might need something a little stronger through the epidural to get her nice and numb. Because again, they take a little minute to because again, you got to be intricate. Because it's not like, a C-section and those big abdominal muscles that you put back together. You gotta think, this only about this much space.
Yes, it's about 4, finger breaths, or like 4.
Yeah, literally,
not 4 inches, like max.
Yeah, to put back together. So you have to think those layers you have to put the right layer back together.
And you have to put them back together from the inside out. Mm-hmm. So that, 1, it appears the way that it's supposed to appear. And 2, it works.
I was going to say, make sure it works.
Make sure that it functionally does what it's supposed to do.
Yeah, because again, that's a muscle, and if we don't put it back together,
and it's a mind muscle. Like, I'm sitting here and I can squeeze my anal sphincter together. Right. Like, it's a mind muscle, so I got to make sure that
it can move when I tell it to move.
When I move, you move.
Just like that.
Otherwise, you're gonna poop on yourself.
Yes.
So, or not be able to hold it, whatever. So. It sounds scary.
It sounds scary. Please remember that it is not often, like it's not common.
Yeah.
My scary story was very scary. However, that woman had a lot of other things going on for her, and like I said, she just had poor tissue. Mm-hmm. Yeah. So don't be freaked out.
Yeah.
And there are things that we can do to help this. Yeah. To prevent from this happening.
And there are also sometimes they're just unavoidable.
They are unavoidable. Like, if you got a big baby, you got a BAB.
A big ass baby.
Yeah.
The
head is just...
She's forgiving, but baby, listen, let me tell you something.
She's like, I can only do but so much.
I can only do so much. Girl, I'm doing my best down here, okay? Girl, I'm doing my best.
She's like, I am literally stretching from one end to the other.
I'm at my max.
And a lot of times what happens is some women, I don't know. I don't know if everybody has it, but like there's a band, a really, really tight band in the perineal floor, and it doesn't give. It just doesn't give.
Yeah.
It doesn't give. And when that baby is coming through it, it says, you know what?
Girl, get out the way.
Me or you.
Girl, get out the way. Because I'm on my way out. Girl, get out the way.
And it's unavoidable. Like you said, it's unavoidable.
And like you said, sometimes babies are coming down, their hands up by their face. You got that compound presentation. Like fists, elbows, and sometimes they just be paving the way with whatever.
And I was about to say, a lot of times, if you do have a tear like that, it's because you have a compound presentation, and that baby's elbow is coming right through your rectum.
And again,
there is nothing I can do.
There's nothing I can do, and there's nothing you did wrong. Like your baby was just like, girl, you want me to come out?
I'm coming.
Either take it or leave it. Literally take it or leave it, because I'm coming. So yeah, it's just one of those things where it's like, I can try there's a lot of things that we can do, and we'll talk about them. But sometimes those lacerations are just unavoidable. But we gonna get you back together, Snake.
We're gonna put it back together,
and we're gonna talk about how you can
So
take care of it later.
as a provider, things that we can do, and you as a birthing person can do to try to prevent these things from happening, right?
Not to say that if you do them, it's not going to happen, but you can take the necessary precautions to, try.
Some people wholeheartedly believe in perineal massage, where you take your two fingers, insert them in the vagina, and essentially massage from left to right in a rocking motion, starting at like 36, 37 weeks. You can do that. You remember we talked about evening primrose oil? That's a good candidate for something like that, or like coconut oil or something. Not coconut oil, olive oil. I had to ask some of my friends about that because I don't recommend that. I just keep your hands out of your vagina. That's just my thing.
Just leave her alone.
Leave her alone because she's forgiving.
She gonna do what she's supposed to do.
She's gonna do it. While pushing and your baby starts to apply pressure to that perineum, I'm a advocate for a warm compress. Oh yeah. Can I get a warm washcloth, please?
Yeah.
That
as a nurse, even if let's say I'm not. I don't have like a midwife patient and I'm in the room pushing by myself. I will certainly get a warm washcloth, and sometimes we'll even put like a heel warmer. I'll pop it and put it in the washcloth to make it a little, because sometimes the water just doesn't get warm enough.
That's smart.
So take a heel warmer, put it in the damp washcloth, and put that there.
Yes, I love that. Yeah, I'm start telling my nurses.
I've done that before because so as a nurse, and once you have seen enough, you can kind of see where that tissue is starting to get really like stretched, and it's like, ooh, let me just put a little something warm there just to maybe help with what might be inevitable, but I'm gonna at least attempt to try to help it not be so severe, maybe.
Correct.
So warm compress. We talked about perineal massage. Those are just some things that we can try to do to prevent that.
Yes. As well as, which I've seen the girlies on TikTok and Instagram beat people up and down for this, but baby soap. Johnson & Johnson baby soap.
Like while they're pushing?
Yes. It depends. I do not use it until I can see this much head, which is like, what is that? Like 6 centimeters worth of head on the perineum, not with my hands in there or nothing.
Right.
That's when I will use it. And the only reason I use it is because sometimes you just need a little lubricant so that you do not tear like that.
Yeah.
It also like helps the baby. It kind of creates like a little slip and slide and helps the baby come out easier, I guess.
The facility that I have worked at, they actually use 100% mineral oil.
And see, you know what? I feel like every facility should have that, but it shouldn't be locked in a Pyxis. Like the same way we stock.
Yeah, that's crazy to have mineral oil and just okay. Yeah, we'll talk about that later.
The same way the Johnson & Johnson is stocked. I feel like mineral oil should be stocked.
Yeah. I like a mineral oil.
We used to use Castile soap. But I think it's the AAP said no more Castile soap.
Because it burns.
Because Johnson & Johnson is safer babies, safer. Tear free. Like that's the one that we typically use. Also, babies are not coming out with their eyes open.
Correct.
Their eyes are closed until they come out of the vagina.
Yeah.
And then it's opened. But there's also like vaginal secretions that are also helping this baby like kind of slide down, slip down.
Yeah.
When you've been pushing for a long time and that light has been on your perineum and you have the moisture has started to like dry up, that's when I will use it.
If I notice it's like visibly like dry.
Yeah.
Or like maybe we just didn't have a lot of amniotic, maybe it's just like yo, we just ain't got a lot to work with. Okay, we gonna
Yes.
And I'm like you. I need to see
a good amount of head.
Need to be on the perineum for me to just
right.
Because I mean,
and like I said, I want it on the head. I don't want it in the vagina.
Right.
If that makes sense, I want it on the head and like maybe 1 or 2 millimeters inside the perineum, but not in the vagina because that sounds like a yeast infection.
Yeah. Yikes.
All right. I'm off my soapbox now.
It's fine. Now, this is it's not essentially a tear that happens naturally, but I know I see these on a lot of birth plans.
Yes.
We're talking about episiotomies. I think they're talked about a lot, but I don't think people realize that they are not done very often.
So, ACOG, the American Academy for, the
American
ACOG,
College of
Gynecology and Obstetrics. Them
Obstetrics
people,
and gynecology. Yeah.
Those peoples, the founding fathers of maternal health at this point.
Oh boy.
Anyway, have not recommended. I'll say that not recommended episiotomies since 2006. And they did another study in 2020 and where it was like 30% of women were getting episiotomies. It was down to like 12.
Ooh, okay.
So
not very common.
Right. It's no longer recommended unless we need to get this baby out in a expeditiously manner.
Yeah. And so just to explain, an episiotomy is a cut that
with scissors.
With scissors.
Very, very sharp scissors.
That the doctor actually uses to cut the perineum.
Yes.
It can be like straight down, which you call is it midline? And then I've mostly seen it the one cut to the side.
Yeah. And it's like it's not a big cut, y'all. Like it's not
tiny.
It's a tiny little yes, and mediolateral.
That's the word. I was gonna say something lateral.
To the side.
Yeah.
Mediolateral to the side. And it's literally like a very, very tiny snip. And it's just if the tissue is not giving, or like I said, I need to get your baby out for whatever reason, then that's when it is done. I've only seen one provider do it, and she does not do it often.
Same. We're probably talking about the same provider.
Probably.
Yeah.
And it's more so she works with a specific population of people that have tissue that just does not
tend to have that tighter like perineum tissue.
Correct.
And a lot if we're not like one of those things where it's like we're trying to get the baby out like expeditiously, if providers are doing it, I think it's a judgment call that they make because it's like if I don't initiate this myself,
she might end up with a
fortune. Like her tissue is just going to literally like just explode in all different which ways. And if I can do it in a more controlled manner, I can kind of control where this tear is going to happen. If I start it here, then I know it's just going to like follow this line kind of thing. Again, like you said, not done very often. I get why you put it in your, you know, your birth plan. I totally get it. Because like, who wants to be snipped on? Yeah. Not me. So I can see why it's there, but just know that those are not done very, I haven't seen one in.
It's been a long time since I've seen one.
In a long time.
I'd probably even venture to say like maybe 4 or 5 years.
I was gonna say it's been probably at least 2 to 3 since I've seen one.
Yeah.
At least 2 to 3 years. And I've seen a lot of births.
Yes.
Hey there, wonderful listeners. It's Briea here, one of your hosts for the Laborhood Podcast, and we've got some incredible news to share with you today. The Laborhood is now proudly a Kindred Bravely ambassador. But what's Kindred Bravely, you ask? Well, let me tell you about this amazing company that's all about supporting moms just like you. Kindred Bravely is a brand built on love that's poured into every single piece of clothing they create. Their meticulously designed clothes are here to make your journey through motherhood a little easier, from the bump to breastfeeding and beyond. Because let's face it, mama, you deserve to look and feel great all the time. Kindred Bravely understands that, and they're here for you every step of the way. Now, here's the exciting part. We have a special offer just for you, our incredible community. When you shop with Kindred Bravely using our unique code, you'll get an amazing 15% off your purchase. That's right, 15% off. So how do you claim this offer? It's simple. Just visit and use our code LaborhoodP15 and shop till you drop. At checkout, be sure to use the unique code LaborhoodP15 to unlock those savings.
I think the last time I saw one, we were in a shoulder dystocia.
And that's what I meant by an expeditious delivery.
Yeah, like baby was stuck literally, and there was just no space for that provider to get in there and deliver that posterior arm or whatever. And so she literally, I mean, like when I say that baby was not moving, that baby was not moving. And we were on like 60 seconds and just no movement whatsoever. And so she had to go in and cut in a piece so that she could slide her hand in there.
And that is like more often the reason why people get episiotomies is because I cannot physically get my hand in your perineum to get your baby's shoulder out.
Yeah.
That's usually
that baby was huge too. I remember. I think it was like an 11-pounder. Yeah, it was like an 11-pound baby. It was an unexpected like thing. Like they were not expecting the baby to be that big, and literally it was just like head came out, and all you saw was cheeks, and I was like, oh boy. So yeah, that was probably the last one I saw, and again, that was 2019. Yeah. 2019, 2020, somewhere in there. Yeah. So it's been at least 3 years. Yeah.
Old Wohog is the last time I saw.
Oh, yeah. Long time ago.
Long time.
Shout out to Women's Hospital of Greensboro.
It's no longer there.
It's not. That's where we got our start, though. It holds a special place in my heart.
Ditto.
So, yeah, you know, Appease, she's not everybody's favorite, but, you know, sometimes we need her. To do what we need to do.
She's not being done for fun.
No, not for fun. Not at all. Not fun at all. Not fun at all. So we have our laceration. Again, you know, happens usually right after birth. Whether I have a laceration or not, my mom has an ice pack on her perineum because so, a lot of stuff just happened where it got torn, whether it was torn or not. Whoa, that was traumatic. You know, there's a lot happened down there. Yes. So there's already ice pack on her perineum.
Yes.
But that is a huge part of the aftercare if you have a laceration.
If you have a laceration as well, and I had to repair it with lidocaine and all the things, I will also pour lidocaine.
Yeah.
Either on your pad or depending on where your tear is, I may even pour it right there on top of the tear to give you just a little bit extra numbing.
Yeah.
Or like I have even like taken my finger in the lidocaine bucket and then rubbed it like on the outside like that.
Oh, okay. I think we didn't like miss it, but we kind of need to chat because we talked about tears that happen around and through like the perineum and the rectum, but tears can also happen in other places. And I don't want people to be surprised.
Yes. Okay. Very common tears. Like we said, on the perineum. You can also get labial tears, like
On the lips.
On the lips.
Yeah.
On the inside of the lips. You can have sulcus tears, which are inside the vagina on the lateral aspects. I'm trying to figure out how to say this.
Like imagine a wall?
Yes.
Like on the wall of your like
yes.
your
So
vagina.
if you think of like the vagina as a triangle,
right.
and your clitoris is at that top point and the other 2 points are off to the side, think about that inside the vagina.
Okay.
And so those 2 points, and those can bleed kind of heavily.
Yes.
You can also have cervical lacerations where your baby said, bump getting the complete. I'm coming now.
through here.
Those can also be heavy bleeders. And if you do not have good pain coverage, that's another one where you may end up in the OR just for visualization and more pain control.
And typically, sometimes you might not know it's a cervical laceration
Until I done did everything.
or
but
until it's like, why is she
she's
still bleeding? Like, what
her
in the
uterus
world?
is
It's
firm. Her bladder is empty.
Why are
and
we still
she
bleeding?
is bleeding like a stuck pig.
Yeah,
What is
what's
it?
going on?
And
And
it's-
come to find out, it's
It's
like
a cervical laceration.
cervical lag, you little shithead. Also, one more.
You can also have, actually two, you can have what we call periurethral tears, where you tear, and these are usually first degree tears, but they're right around where you pee at. Like right beside the hole that you pee at. And so it
Because
burns
it's
a little
not the same
bit.
hole.
Because it's not the same hole. Oh, did y'all know y'all got 3 holes down there?
I hope they did.
Okay, if you did, you got 3.
There you go.
Your urethral. You can have a periurethral tear. You can also have the mother of tears. You can have a clitoral or a periclitoral tear. We all know that that's the fun button, and it is very sensitive.
Yeah.
It is also, when that tears, it is very hard to numb. I can do everything under the sun.
There's so many nerve endings.
There's so many nerve endings in the
So many nerve
clitoris,
endings.
and I will try
I
my
can
best.
take the edge off, but baby, you might feel a little poke. You might
Yeah.
feel a little something.
I actually had a patient with a clitoral, not even like a periclitoral where it's like on the outside. No, she had a clitoral tear straight up the top. And there was nothing I could do. There was absolutely nothing I could do.
She just had to thug it out.
She had to thug it out. Like, I gave her a lot of numbing medicine, and she could feel everything. Luckily, she didn't need that many. Like, it just needed those 2 little, like, very, very quick ones. But I was like, baby, I will try. I used the smallest needle possible to numb her. I used the smallest needle. I mean, like the smallest suture, and even like touching it with like a cotton lap
like,
pad. She was like, "This is a lot of pain," and I'm like, "I am so sorry,
So
but
sorry.
you were bleeding,
Yeah.
and I have to repair this. I can't let you walk home."
Yeah, because you're just gonna be dripping. Like, it ain't gonna
She
stop.
was pouring. It
Yeah.
was like I had sliced an artery. Like,
Yeah.
it was wild.
Like, I can't even hold pressure. Because as soon as I take it away, it's like, phew.
Pew, pew, pew,
Yeah.
pew, pew.
Oh, waterfall.
Little waterfall.
Yeah.
Yeah. Anyway, but
So,
yes,
yeah.
you can have a clitoral tear. It's a sensitive area.
Yeah. Okay, so how we take care of it? First off, ice, baby. Dum, 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 dum. Dum, 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 dum. Okay.
I'm gonna let you have it.
Ice, thank you. Like I said, soon as we get done, I'm popping an ice pack and I'm putting it on there because
Yes.
that helps with, of course, like pain, swelling, which you're gonna have. You know, it's gonna be swollen. So ice it up. When that ice pack get warm, toss that bad boy and you pop another one and slide it in there.
At least for the first day or so. Like, at least.
It's gonna be cold, but you're gonna be like, ooh. But
good.
yeah, I was gonna say it's gonna feel good and it's gonna be your friend for sure.
Yeah.
Peri bottles. So the little
That's
plastic
your best
bottles that we give you in the hospital. So like we call it some people call it the spray bottle. A lot of people will use those when they're going to pee.
Yes, dilute that urine, girl.
Yes, because what it does, we tell you to fill it up with warm water. And while you're peeing, squirt it towards your urethra, like, because again, very concentrated urine on those scrapes and those lacerations.
Urine
can
is acidic,
burn.
like in any form. So
if we can dilute it a little while it's going into the toilet,
look, again, we're all adults. Y'all know when you then got a little aggressive during fun time
and you pee that yeah. So imagine that with like a cut.
Yeah, like a cut.
Yeah.
That bled. Okay,
like, a real cut. So dilute that a little bit.
That urine.
Yeah.
Okay.
When you go to wipe, don't take that hard tissue and just
baby,
go
get
down
you a
there.
washcloth and you pat.
Just
pat dry. Pat dry. Okay.
We have sitz baths.
Yes.
Which I've heard are great.
Yes.
I've heard. Yes. I've heard, and because they help with other things like hemorrhoids and things like that too.
Yes.
So sitz bath.
People, my HS girls, y'all with the hydrogenitis suppurativa, get you a sitz bath, girl.
See, good to know. Sitz bath, warm water.
That's literally all it is. It's about, I don't know, like 2 inches of warm water.
Just sit over it.
And you just sit over it. You can even like get in just a little bit. Yeah. They're nice.
Yeah. Get you a sitz bath. Especially now this one, if you have it a 4th degree, which again we talked about, is all the way through that anal sphincter, a donut pillow. Cause like, girl, just don't be plopping your behind anywhere, cause it's gonna hurt. Especially you going to sit at the kitchen table. Every chair is not comfortable like your couch or your bed. Get you a donut pillow to sit on and get you a little cushion so your butt is just like just sitting on something.
Yes, agreed.
We want to be as gentle with this area as possible until she gets back to where she used to be.
Hey everybody, this is Shay, one of your co-host for the Laborhood Podcast, and I'm thrilled to share some exciting news with our incredible listeners today. The Laborhood is now an Amazon influencer, and I couldn't be more excited to introduce you to our very own Amazon storefront. You might be wondering, what is an Amazon influencer and how it impacts or benefits you? But I'm here to provide you with hand-picked recommendations for products we truly believe in and use in my everyday role as a baby catcher. Our storefront is a carefully curated collection of items that I found to be incredibly valuable for both the birthing person and their precious babe. From essentials for new moms to must-haves for those special moments during childbirth, we've got you covered. And here's the best part. When you shop our storefront, you're not only getting access to tried and true products, but you're also supporting the Laborhood Podcast. Your purchases through our storefront help us continue our mission of advocating for maternal health and empowering birthing persons. Plus, I want to be fully transparent with our amazing community. So when you make a purchase through our Amazon storefront, we may earn a small commission from Amazon as a part of being an Amazon influencer in their program. So not only do you get fantastic products that I personally recommend, but you also contribute to our efforts to make a positive impact in the world of maternal health. To start shopping and explore our hand-picked selection, simply visit www.amazon.com/shop/Laborhood Podcast, or you can click the link in the episode description or link in our bio. Don't miss out on these incredible finds that can enhance your birthing experience and support new parents on their journey. Thank you for being a part of the Laborhood gang and for helping us make a meaningful difference in maternal health care. All right, let's get back to this.
Pain control. Girls, don't be walking around in pain.
No.
Because you're going to be, you're not going to want to move.
Correct.
You're literally going to you're going to be contracted because you're going to want to sit so still. So it's
and the thing about it is, in order for you to get back to the way that you were, you need to
you gotta move it.
And move
you got to move it.
To get that soreness out, you got to get up and move.
Just like when you go to the gym.
Yeah.
You mess around and be...
Will you roll out of bed in the morning?
But literally, you don't feel better until you just start moving again. But you can't do that if you are in die-hard pain.
Correct.
So if you need a little something to take the edge off so you can kind of walk and get moving again, please do not hesitate to ask your provider. Just like, look, I'm hurting. I'm hurting so bad to where it's preventing me from being up and mobile.
Yes.
I promise you, your provider will help you out. If
anybody tuned into Dr. Butler's episode, she talked about do not be afraid. If your regular 800 ibuprofen and Tylenol is not covering your pain, do not be afraid to ask, because we can absolutely give you something else. Also, dermaplast. The holy grail.
Listen, I think it's so funny because I will hear mamas using dermaplast, and when I tell you that can be about empty,
hearing the little thing shaking at us.
I mean, just spraying.
Ding, 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 ding.
Listen, it's rattling. But my girl said, I ain't trying to feel nothing. And listen, can't say that I blame you.
I can't either.
If I ever come to the day, I'm a 2 cans. Just, girl.
Dermaplast is a numbing spray that you can literally spray on your hoo-ha, and along with that ice pack and your ibuprofen and your Tylenol, you might be good to go. Yeah, that'll get you through the rough patch. Yeah, that'll get you through the rough patch. So numbing spray, your dermaplast. We give it to you in the hospital, but it is over the counter. You can get that. Walk in Walgreens.
You can run to Walgreens, get you a little can.
You need your baby daddy to go get you a re-up.
Yeah. Go get this.
This is what it looks like. Tux. I love Tux pads.
Yeah, so Tux pads.
Especially if you got hemorrhoids.
Yes, which Tux are pads. Also a thing. But Tux pads are these little thin pads. They're literally called Tux, like Tucks. Tux pads. And they have, it's witch hazel on them. And you can line them.
They're medicated.
And you put them on your pad. Like some people, it's so intricate. Look, it's like
it look like a sub.
It's like a masterpiece that they put together.
It's like your provolone cheese.
It's like they got peri pad, ice pack, Tux pads, dermaplast. Like it's a process, but maybe once they pull it all up, they're good to go. They're good to go. So listen, whatever you have to do to get this thing healing, do it. Now, this next one is very important, and I'm going to tell you a little secret about myself when we get to this one. Avoid constipation at all costs.
Yes.
So drink your water and take your stool softeners. I know y'all be in the hospital. Trust me, I've floated a mother baby before, and I say, do you want your stool softener?
And no, I don't want it. Now, especially if you did ask for narcotic pain medication.
Girl, don't you lock up and have to be... So, fun fact. I am deathly afraid of being constipated postpartum. Like, it's a fear. Because I've heard horror stories about people who were literally like, they were like, no, it felt like I was passing another child. Okay. I've heard it more than once. And when I tell you that is ingrained in my brain, just know when you see me drinking water postpartum, there's Miralax in it. Because I am so afraid of being constipated. Like, deathly
Have you
afraid.
Never been constipated before?
Yes, but I can't imagine postpartum dealing with something like that either. True. Especially if you've had like a section, or again, you've had to use some narcotics, and that peristalsis just ain't peristalling like it used, like it's supposed to be.
Peristalling.
It's stalled.
It is peristalling.
It's not moving. I am deathly afraid. So yeah. I'm going to immediately just start chugging Miralax. Don't want to be constipated. A lot of water. Drink your water.
Drink your water. Take your Colace, your Docolace, whatever they have prescribed for you.
Take it.
Because
you don't want to be stitches and straining.
You don't want to be constipated.
You don't want to be sitting on the toilet. It's already uncomfortable having to sit on the toilet. Now you got to sit there because you can't poop. And you're straining. So you got hemorrhoids, you got stitches, you're constipated. Okay, girl, something gonna have to give.
Southern. You got hemorrhoids, you got stitches, you're constipated.
Something gonna have to give. Something gonna have to give.
Yeah,
Don't let it be something preventable. Like you can prevent some constipation.
Yeah,
so
yeah.
take your
Drink your water.
Drink your water.
Drink your water.
Yeah.
Okay. For the girlies who have tears, always be mindful of what your body is doing. Because any time the skin is altered in any kind of way, you're at risk for an infection, right? And so this is a very area that is very highly susceptible to infection, right? And so we want to make sure, without a shadow of a doubt, that you do not develop one, because nobody wants that. So think about, has it gotten more painful?
Yeah.
Is my medication, am I on all the medications and it is still painful?
It's still hurting.
It's still hurting.
Or has that pain progressed instead of like
gotten
better?
Yeah. Am I running a fever? Yeah. Is it smelling weird or gross?
Yeah.
Like all
kind of foul. Like,
yeah, like
this ain't just like, well, I mean,
the vagina has a smell, guys. Everybody.
And also blood in general has a smell.
Yes.
But it's not that.
It smells
normal.
gross.
It has a foul smell.
Yeah,
not just like
stinks.
Yeah, literally. Like it's like, blood has like a metal, almost like a metal.
Yeah.
It's not that. It's
something else.
It's something else. Yeah.
Have your pads gone from like red to clear? And now you're starting to see green, yellow.
Yeah.
All of that is signs of infections. And we want to nip that in the bud. Go ahead and call your provider, your on-call nurse, your on-call midwife. Call the people that need to be called. Yeah. And if you are even worried about, like, you know what, something just don't feel right.
Yeah.
Get a visit in. Call your doctor and be like, hey, look.
Had a baby, a couple weeks ago. Some just don't feel right. Some don't feel right.
Right.
Because sometimes, those sutures dissolve, but sometimes one might kind of get loose or it might be sticking and it's just like, girl, something ain't right.
Something ain't right.
And sometimes you can go in the office and if the provider can look and be like, oh, it just needs to be snipped a little bit right here.
A lot of times because the suture, like the actual stitch itself dissolved, but the knot where we tie it off, because it's so much of it, it doesn't dissolve. And so you're like, something is poking me and it hurts.
Yeah.
I go in there and I'm like, oh. And a lot of times the stitch itself has dissolved, but the knot is just kind of like hanging on. And I just go in with a pair of tweezers and take it out. And you're like, oh my God, that feels so much better. I'm like, yeah.
So if something down there don't feel right, girl, call somebody. Don't mess with it yourself. Just
no,
because I don't want you messing nothing up. Call somebody and just tell them what you feel, tell them what you see, and just be like.
Also, something that can happen is called granulation tissue, where the edges don't quite line up completely together. When your repair happens, doesn't mean that anything is wrong. It's just that the healing tissue has nothing to adhere to. It has nothing to stick to.
Gotcha.
And so it's kind of open to air, and it may sting a little bit more. Go to the doctor. We can do something for that. We can fix that.
Yeah.
We put a little silver nitrate on it, and boom, you're done.
What's silver nitrate?
It's a cleaning-ish agent, but it's literally like actual silver that they coat in like jewelry and stuff. But what it does is it adheres to that new tissue and kind of stops the healing process and causes it to I'm trying to say it in layman's terms, causes the discomfort to go away. It essentially like gives you a layer, like an outside layer.
Gotcha. Okay.
To not be painful anymore.
Gotcha. Okay.
Did that make sense?
You know me. I'm an L&D girly. So once the 2-hour mark is up, I know some things. I don't know a whole lot. So I was like, I've heard of silver nitrate before, and know what it's used for, but didn't quite know like, okay, but what is, what is it?
Essentially like stops that new tissue from trying to create
that next
like a scab.
Yeah, like a scab. Okay, gotcha.
If that makes sense.
Yeah, no, that makes perfect sense. To me, it makes sense.
Okay,
it makes sense.
Y'all let me know if that don't make sense.
Yeah, we'll talk about it. Slide in our DMs and let us know.
Yeah,
we'll talk about it, or we'll look it up and be like, "Hold on, girl, I'm gonna tell you," and we'll send you a link. You're like, here you go. This explains it way better than I could.
Oh, because I was struggling just now. I was. All right, guys. If you have learned anything from today's episode of the Laborhood Podcast, you have learned that what? The vagina is very forgiving.
She is. And I call it a she because it's a girl. My vagina is not a man. Sorry.
That's not what I was saying.
Oh.
I was just, we are gender appreciative or non-gender bias. Or, y'all, please don't eat me up. There we go.
Non-conforming. That's what it is. Okay. Non-conforming. Not gender conforming.
Right.
Something like that.
Yes. Please don't eat me up. I'm so sorry.
Tell us what the correct term is if we got it wrong. I think I got it right.
I
think we got it right though.
Okay.
Non-gender conforming.
I try to be.
I think that's what it is. I think it's non-gender conforming.
Cool.
Okay.
Birthing persons.
We did use she.
Sorry.
But that was like just my initial like.
You identify your vagina as a she.
Yes, and that's why I said it the whole time.
Cool.
But some people might be like, no, it's a man because she don't know how to act. I get it. I get it. Okay, I get it. Relatable. As always, guys, you can find us. As always, guys, you can find us on social media at the Laborhood Pod. You can find us on Twitter, Instagram, Facebook, and TikTok. You can go to our website, www.thelaborhoodpod.com.
Yes.
Thelaborhoodpod.com.
Yes.
And you'll see this picture, so you'll know it's us.
Hi.
Find us on our Amazon storefront where we have all the fun things that we talked about on here, like your tux, your dermaplast, your peri bottle.
Yep.
Nice, comfy pads and underwear that you can wear. We have linked all those things at our Amazon storefront.
Put your Preparation H on there too.
Girl, listen, you can have you a whole little postpartum setup by the time you even have a baby. You're going to be good to go when you get to the house, okay? So hop on our Amazon storefront. You'll find all those good things there. What did I miss? Is that everything?
Yeah. If you haven't used your Hello Bella link, make sure you use it. We're also partnered with Kindred Bravely.
Yeah.
Kindred Bravely. Get your nursing bras.
Yes, honey. Yes.
They're actually really comfortable.
Yeah. Our friend said it.
I was about to say, it actually made me like, all right, I'm just going to test it out.
I'm going to put it on. Let me just see. I'm going to see how I feel.
Very buttery soft and comfortable.
Listen. I'll be walking around with a nursing bra on and ain't had not near baby.
It'd be like that.
Girl's
sometimes.
comfortable. That's all I know. That's all I know. It's comfy. So I put it on.
As always, guys, I am your favorite board certified nurse midwife.
And I am your favorite nationally certified inpatient obstetrics registered nurse.
You're free to go,
You're free to go. Bye, guys.